Very, very warm welcome to you. We're very excited to have you here today. We're going to wait a couple minutes just for people to join us. So in the meantime, if you want to start off with an introduction, maybe your name, where you're located, and maybe why you're excited to be here today. So just as we're waiting for folks to trickle in, you can say your hellos. So we can see your comments and questions in the chat in real time. And that way we'll be able to communicate with each other. So a very, very warm welcome, and I'm looking forward to reading your names and where you're from. Okay, wonderful. So I think a couple more folks have joined us now. So we can go ahead and get started. A very warm welcome again to everyone who's here with us today. All right, so we'd like to start off with a land acknowledgement and respectfully acknowledge the unceded traditional ancestral territories of the First Peoples across Turtle Island, Canada. So we're very grateful to live, work, study, and play on these lands. As a settler here, I'd like to acknowledge my positionality in now called British Columbia. I'm a first-generation settler on the lands of the Musqueam, Squamish, and Tsleil-Waututh peoples, the traditional lands of the Coast Salish. And so my co-founders are also presenting from what's now called Ontario, the traditional lands of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And we're very grateful to be on these lands here. Okay, so we got an exciting lineup of folks here today. So I'm going to read off a couple of them. We're very, very excited to have Dr. Kate Mulligan here. She's the Senior Director of the Canadian Institute for Social Prescribing, as well as an Assistant Professor at the Dalla School of Public Health in the University of Toronto. And we also have the amazing Dr. Bogdan here, who is the Developmental Lead of the Global... Sorry, it's a little hard to read that here, of the Global Social Prescribing Alliance, the clinical champion lead at the National Academy for Social Prescribing, and the founder of the UK Social Prescribing Student Champion Scheme. So a very, very warm welcome to you, and hello. And I'm actually one of the co-founders and the co-leads of the Canadian Social Prescribing Student Collective. And my other co-leads are here today. So my name is Nilu. Hi. Le-Tien and Caitlin are also here on the call with us.
Look, we all want to be healthy and happy. That's not an impossible idea, a lie, or a dream. And it may seem like quite an obvious thing to say, whilst we sit wondering whether society would allow us to say we were any other way. You know, that pressure of appearance. Are we allowed to say when we're not okay? Because all too often, physical or mental health difficulties get in the way. Whether it's events beyond our control, personal circumstances, or genetics at play. Because if 1 in 5 GP appointments are for non-medical problems, then this could be a time to explore other possibilities and options. Like social prescription, a system that takes a different approach, where they won't just deal with the symptom but sit with you to trace it, understand the cause, and then create a plan to replace it. Talking about your health, finances, housing, or stress, before linking you to activities that empower and suit you best. What if you were prescribed a social engagement, a social arrangement, to get a pep in your step in your feet on the pavement, a brush in your hand, a tune from your lungs, a talk and support to help you manage your funds. I'm talking about a place to feel connected with the community you've selected, making your activities more effective, experiencing as a collective so you are positively affected whilst feeling safe and protected. Surrounded by new people, allowing you to feel part of something bigger than you. We all want to be healthy and happy. And it's not just a nice idea, but a system that works, that asks if medicine isn't the only option and puts you first. With a wide range of solutions to help you get through, a social prescription could help you too.
Wonderful. So that was a really great introduction video. We're now going to pass the mic on to Caitlin, who is one of the co-founders of the Canadian Social Prescribing Student Collective, and she's going to give us some more information on social prescribing.
Thank you so much, Nilu. So first of all, a big thank you to every single one of you who has joined us today. We're so happy to have you here. And for some of you, social prescribing may be a new concept. For others, you might just be kind of familiar with the concept, or you may even be an expert in this topic area. So what we really want to do is just kind of take some time to go over what social prescribing is. And we felt that that video from the National Academy for Social Prescribing was a great way to start us off. It really kind of provides that powerful explanation of what social prescribing is. And so we're really thankful for that. And now what we want to do is kind of look at this from the Canadian lens and look at some really new material that just came out. So this is a social prescribing pathway that was recently developed by Bridgeable for the Canadian Institute for Social Prescribing to illustrate the current state of social prescribing in Canada based on primary research and conversations with social prescribing experts. So according to this work, the social prescribing pathway consists of 5 stages. So this includes entry into the referral pathway, connection to a referral source, attendance at a social prescription program or service, follow-up from a dedicated individual, and a warm or open-ended exit from the program or service. So that enter phase illustrates the various points through which an individual might enter the social prescribing pathway. And the entry points vary across initiatives and might include primary care, social and community services, or self-referral. And then the connect phase illustrates the point at which an individual will co-create a care plan that may include referral to resources that support their well-being. And it also highlights the dynamic role of the link worker and their role within the referral process. And of course, this title, this role, goes under various names. So link worker is just one of many different names. The attend stage then illustrates how an individual may engage with supports and activities that improve their health and well-being. And these services might help support social inclusion, fitness, mental health, financial well-being, food security, and community connection, among others. The follow-up phase illustrates the ongoing communication between a connector and an individual, and in order to evaluate the care plan. And so at this stage, there may also be an evaluation of outcomes on an initiative-wide level. And then finally, we have the exit phase, which illustrates the various points at which an individual may choose to exit the social prescribing pathway. And it also depicts a closed loop exit, which represents the potential for future re-entry into the social prescribing pathway. So that's a quick overview of that. So now that you've watched the video from the National Academy for Social Prescribing and learned about the social prescribing pathway in Canada, hopefully you have a better understanding of what social prescribing is. But what I haven't touched on yet is the definition of social prescribing. So as of right now, there are several different definitions of social prescribing in use, but I want to highlight a definition from a recent publication by Morse et al. On global developments in social prescribing. So in this article, social prescribing is defined as an approach that enables a range of stakeholders, often based in healthcare, to refer individuals to non-clinical interventions, such as social activities and social services, to empower individuals and improve their health and well-being. So this definition highlights some really key aspects of social prescribing that I want to point out. So this includes the fact that the stakeholders that are involved are often based in healthcare, but not always. Also, the fact that it's really about connecting people to non-clinical interventions. And finally, the goal here is to empower people and improve their health and well-being. However, as I mentioned earlier, as of right now, there are several different definitions of social prescribing in use, and this is kind of problematic for social prescribing research, policy, and practice. So I'll quickly highlight this here. So this is really where my thesis work is coming into play. So the aim of my study is to develop internationally accepted conceptual and operational definitions of social prescribing through the Delphi technique, which is a method of gaining consensus on a particular topic through multiple rounds of questioning of experts in the field. So I brought together a panel of 48 social prescribing experts who represent 26 different countries across 5 continents. And this is the first time here that this map is being released to the public, which is really exciting to be able to share with all of you. And so the first round of this study began in June of this year, and the third round just closed last week. And I can't share any more details at the moment, but what I will say is stay tuned for some very exciting news about this study. And so that kind of wraps up our little discussion here about what is social prescribing. Hopefully that's given you a nice understanding of what we're talking about here today. And so next up, we're going to be hearing from Bogdan. So over to you, Bogdan.
Wonderful. Thank you ever so much, Gillian. And kudos to you all and the fantastic work that's been going on in Canada. It's fantastic to see some Singapore students as well. I noticed Paul in the background as well, talking about the activity that's going on in terms of students who are enthusiastic and excited about what the future holds in terms of health and healthcare transformation in general as well. I can see we have a very wide audience today, so I know we're not going to satisfy each of the segments, but I think what I'm going to want to do is simply go and do a bit of a deep dive into why this is relevant and why healthcare systems across the world require a drastic change in the face of workforce pressures. And as we are facing more and more doctors and clinicians who are burned out, more healthcare professionals who are working under tight conditions and tight resources as well. So if we could go to the next slide, and this is my email. If anyone wanted to reach out or you had any questions beyond this presentation, I'd be delighted to help. So I, like Caitlin, Le-Tien, and you, and many of the students in here, got involved actually back in the day when I was a student myself. And if we move to the next slide, it was a personal frustration of mine, really, that this is what my medical school training looked like. So as a training physician, I was being taught about all of those arteries and blood vessels and muscles, and we were really taught at the time in an algorithmic way. We were told that if high blood pressure, then you have to prescribe this pill. If high blood sugar, then you have to follow the diabetes pathway. And so there were these guidelines we were blindly following without asking ourselves if loneliness or if struggling with social connection, then what do you do? We realized that you're missing some algorithms in that teaching that you get at medical school. And then we also realized that this goes far beyond the doctor's training. It's not just for doctors, it's about health in general. So if you really think about it, what's wrong is me being in the emergency department, having to spend around 10, 15, 20 minutes with an individual and with a patient, and having this system of a revolving door, a constant one in, one out, where I get to see a patient, but I don't have time to understand what truly matters to them and what's at the root cause of their problem. I would spend some time with them. I would then send them back into the local community to what made them sick in the first place. And I would complain that I don't have time to understand what truly matters to them. And so social prescribing for me provided that hope for the future. It provided that opportunity to really take a deeper dive into social determinants of health, into health inequalities, and to look far beyond pills and procedures, not as a criticism of modern medicine, but to say that the definition of health is not just to patch people up and to stick labels on them and to diagnose them, but to really look beyond those labels and to see them as individuals with personal needs, and to use shared decision making to involve them in the process themselves as well. And if we move to the next slide, please. This really illustrates a few examples from my clinical practice. In a busy emergency department a few months ago, I've had the picture at the bottom over there is a 17-year-old girl. It's not the actual patient for confidentiality purposes, but there was a girl who came in with fluttering chest pain, chest ache, and she was in the 6th time over the course of the past 3 months, and she thought she has a heart attack. When we were doing the tests, when we did the ECG, when we did the blood results, all of it was absolutely normal. Now, what happened in the past was that she was sent home, and she was told that she's got nothing wrong with her. I was looking through her notes, and I could see that everybody deemed it as just an anxiety attack, a panic attack. And what I did on my shift was to simply ask what happened, and I spent 5 or 10 extra minutes to understand what was stressing her out in her life, what was the stress factor in her life. What I found out was that at 17, she just gave birth to twins, and she was worried about the financial situation at home. She didn't actually have a stable income. She didn't have a stable place to live in. And so she was constantly worried that she will not be able to cater for the needs of her newborn babies. And so the important aspect to her wasn't the medical aspect. She was coming in with medical symptoms of what she thought was a heart attack, but what was stressing her were really the social circumstances that she was living in. And so what we did at the time is we simply took a few extra minutes and we referred her to a social prescriber who then supported her with financial support. They got her to apply for benefits and housing, and this really improved her situation, and she stopped coming into the emergency department ever since. Funny enough, the irony is one of the seniors that I was working with at the time told me that I'm a nice doctor, but I care too much. And in a real situation, I wouldn't have time to do that for all of our patients. And that really made me wonder, how sad is it that we've gone into this paradigm of thinking that health is all about patching people up, into fixing the broken or repairing the individuals that have already fallen ill, instead of trying to see this as an upfront investment to support individuals. The second example, which is at the top of the slide there, was a child that I kept on seeing coming in and out from the GP practice, and he was on the maximum dose of inhalers. He kept on coming in, a 10-year-old boy, kept on coming in. We maxed out all of the inhalers to the maximum dose that you can give, and then he would still come back. Now, any good clinician would ask about smoking. What we didn't realize up until we got involved as social prescribing link worker was that they had significant mold and damp within their house, and that was one of the issues that were causing the asthma exacerbations. So you could prescribe as many pills as you wanted to, but unless you sorted the housing, the social determinants of health of that child, you would have not helped them entirely. And those are just a few examples of how social prescribing looks like in action, at least in my job as a rather young medical doctor as well. If you move to the next slide, just a brief overview really of what our work at the National Academy of Social Prescribing looks like. We work with several academics, and I've noticed Karen in the background as well, kindly joining the talk, who's one of the leaders involved in the Evidence Collaborative. We work with 8 universities from across the UK who provide high quality evidence and provide summaries for making the case for social prescribing. And that, as you all know, is crucial. So that's one aspect, but we also work with other leaders to accelerate innovation, both in terms of new ideas, but also innovative partnerships across the sector. How do we work with the arts? How do we work with the sports sector, with nature, with heritage and historic sites and cultural sites as well as working with financial and practical support that we can get for our patients and with such institutions as well. We've also launched a global social prescribing alliance, which I'll talk about in a second, and a few other fantastic programs looking at the community work, because as you all know, we could prescribe as many activities as we want, or the link workers could refer the individuals to as many activities as possible. But if the community and voluntary care sector are not supported fully, we will run out of resources to help our patients. And that is the Thriving Communities branch, which launched a fund together with partners to provide small grants for organizations and support them with their work as well. And we've also developed a champions program, which really mimics the idea of enthusiastic individuals, both students, but also clinicians themselves and non-clinical staff across the healthcare system who can act as an advocate and as a champion for social prescribing within their workplace. And they're really there to help integrate the newly formed social prescribing link workers. Next slide, please, Caitlin. This is what the social prescribing link worker model looks like within England. So you have the most valuable hero that sits, that's the unsung hero really of social prescribing, which is the link worker from my perspective. You might see these fancy titles in the media about doctors to prescribe exercise or to prescribe nature and prescription. Well, we don't really do much as the clinicians. It's really the social prescribing link worker that does it all. The link worker, after the referral, once I realize as a clinician that there's not much I can do from a medical perspective and that I cannot dedicate more time to that particular case, I will link them with a link worker who does more than I will ever be able to do. What they do is they offer patients the most valuable resource of all, which, as you will know, is time. In this day and age, time is what they need, time to understand what truly matters to them as an individual. And based on that, they support the individuals to be linked with local activities, as some of the ones that you've heard earlier in the notes that Caitlin presented in the video as well. Next slide, please. So does it work? Well, there's preliminary data from the Evidence Collaborative that colleagues have put together that estimates that social prescribing could save up to 4.5 million GP appointments. So that's fewer GP appointments due to social prescribing. And that's incredible if you think that 1 in 4 of our appointments in general practice are for pure social reasons. Now, once again, this is not to say you won't need pills. Nobody's saying that. If you have pneumonia, we would still prescribe pills, but you know, medicine you don't come with pneumonia or loneliness. You come to the doctors with both at the same time, and so you'll need support overall in a holistic manner. And so it's not a challenge for modern day medicine, is really to say that social prescribing complements and supports those individuals to be supported. And you can see how there's a high return on investment for the program based on those statistics as well. Next slide, please. And one of the programs that we keep very close to heart and that we'd like to involve students, and I've noticed the Singapore students involved today, and we've got the fantastic Canadian Student Social Prescribing Initiative launched, and several others across the US. It's a Global Social Prescribing Alliance, where we've got partners from all over the world, over 23 different countries, and we've been fortunate enough to establish a partnership to share resources and best practice through a community of practice. You can find out more, read more in a recent paper that was put together collaboratively with a lot of the people in this room, and also a lot of the people joining us today, and of course a few other resources which you can find there as well. Next slide, please. And this is what it looks like, a true global network. And you'll hear from Kate Mulligan shortly, who's been at the core of establishing really the social prescribing movement in Canada. And she'll tell you more about her lessons learned and how it looks like in Canada. But we've got champions like Kate across the world, and we're trying to break down silos, to work together and learn from each other as much as possible. Next slide, please. And whether the link worker is called differently from around the world, even in Canada, I know that the nomenclature and the name will differ significantly. I know you have other places like Japan where they're called shikatsushien or ASHA workers, which are the equivalent of social workers in India. We're trying to develop a global social prescribing map where we can identify social prescribing models across the world and get people to learn from each other. I always make this joke and say that England doesn't have the best fish and chips. We love learning from everybody around the world, and we're there to share what we've learned so far in England ourselves as well. Next slide, please. The Social Prescribing Champion Program is what I mentioned earlier. It's a partnership between National Academy and NHS England, and it's really all about championing this within the workplace. It's open to clinicians and non-clinicians in the UK, and we're hoping to expand this across the world as well. But essentially, whether you're a receptionist, a discharge coordinator, a manager, a consultant cardiologist, you can be a champion for social prescribing, and we are trying to raise awareness of social prescribing within the workplace through those champions as well. And in the next slide, you'll see what that looks like at a student level. And this is simply to share some enthusiasm from the student perspective. As I said, Caitlin, Le-Tien, and all the student collective have done a fantastic job of raising and flying the flag of social prescribing across the students in Canada. And we're hoping that this will follow slowly across the world as well. But we run an internship over the summer with Harvard University, and we've developed a framework on how to start a student movement should others want to be involved. But Caitlin and her team, together with Nilu and everybody else, will be there to support you for those of you who are eager and who want to be involved in this as well. Next slide, please. I promise I'm almost done. I feel like I've been rambling for so long. It's just a snapshot of some of our previous presentations. And the next slide, please, is really the message that I wanted to leave you all with. I think it's time to change how we see health. It's time to see health for what it is really. It's time to shift the conversation to creating health and not just short-termism and sick care reactive, the sick care model that we've been reacting to diseases in an acute care setting. It's all about co-design, co-creation, patient activation, and shared decision-making with the individuals. And my last slide really is the takeaway message that we all echo, which is health does not start within hospitals. It doesn't start with people like me with white coats and pens lined up our sleeve telling people what to do. It really starts with each and every single one of us within our local communities and our homes. And for those of us that don't have the means to do so, the social prescribing link workers are there to add an extra inch of support, to do the hand-holding, to really support those struggling most with health inequalities. Because it's easy to say, go join a class. But actually, when you have a social prescribing link worker listening to the individual and accompanying them to a class and supporting them to get involved, then that's looking after the true needs of an individual as well. And in the next slide, you'll see a picture of students, but I will stop there. And I truly hope this will be a conference of yours in the future in Canada, and we look forward to joining you in Canada one day. And without further ado, what I think I will do now, Caitlin, is I will hand over to Dr. Kate Mulligan, who will tell you about social prescribing in Canada. Kate, you've been a huge inspiration for us, so I will leave you tell us more about where you are at the moment in social prescribing in Canada.
Thank you, Bogdan, and can everyone hear me okay? Great. Okay. Thanks for being with me today. I am actually speaking to you from the Black Creek Community Farm, which is an anti-racist, community-based urban agriculture project here in the city of Toronto, Ontario, Canada. And I'm here actually because I'll be taking my students to their fall equinox ceremony right after this. So I encourage you to check out Black Creek Community Farm because this is the kind of thing to which people here in the Black Creek community and Northwest Toronto can be referred. So people who present in hospital or at their local community health center with non-clinical needs can be supported to do things like participate in activities here on the farm. There are all kinds of interesting programs and activities happening here for people who might be new immigrants to Canada, members of the Black community, members of Indigenous communities, young people who are looking for career training and development, elders with experience in urban agriculture or in agriculture in their home countries. There's all sorts of interesting stuff happening here at the farm. So I'm happy to be doing that, to be speaking to you from the farm today. Next slide, please. You've already heard a lot about what this model of social prescribing can look like. From my perspective, what's interesting about this is that we're finally able to help connect people to supports and services like the Black Creek Community Farm. Human beings have been providing support for one another in all kinds of super interesting and helpful ways for millennia. But now we might have a new opportunity to use our healthcare visits to actually better connect people to those supports and services. And furthermore, to measure the impact on our health and well-being and on our use of health services. In other words, to demonstrate back to health systems that these pieces of community support can be health promoting. They can move care upstream, and they can relieve pressure on very burdened health systems that have overinvested in acute care with decreasing return on investment. Next slide. The other thing that's really important and significant about the work of social prescribing, from my perspective, is that it elevates the role of community health. This is something that, as I've said, has been an important part of our health and social care systems forever, but it's been made invisible. So this slide shows, for example, in orange, the World Health Organization's building blocks for health systems. But the blue shows all those parts that underpin health systems but have been neglected in our official definition of what health systems look like. Volunteer supports and services, community-based health workers, health production in the home, social determinants of health. And so social prescribing is one way to better connect in and to demonstrate and to make visible this less visible or made invisible labor put in by people who often have been pushed to the margins and face particular health inequities. So here in Northwest Toronto, where I'm sitting right now, for example, communities faced much higher risks of COVID-19 because of connections to poor housing, connections to racism in healthcare, connections to being essential workers, and so on. So we're hoping that things like social prescribing can be used to help screen and refer people through many different doorways to the supports and services that can help address their social determinants of health. Next slide. Now this slide, don't worry about all the details in this spaghetti here, but the thing that's important to take away from this, and this is from just one province in Canada, the province of Ontario, where I live, is that the vast majority of healthcare spending goes to three things: hospitals, doctors, and pharmaceutical drugs. And we are learning that we need to spread that out more. A very tiny fraction here, a very tiny thin noodle of spaghetti goes toward anything related to community supports and services, community health and well-being. And so with the establishment of our new Canadian Institute for Social Prescribing, that's something we really want to change. Next slide. All across Canada right now, there are very interesting and dynamic and important grassroots initiatives happening to bring social prescribing to the people who need it. We have initiatives happening in British Columbia, in Alberta, in Quebec, here in Ontario, for different types of populations facing different kinds of needs. For older adults who are experiencing social isolation and other needs, for people experiencing financial difficulties, for people who would benefit from exposure to arts and culture, and for people from specific communities facing very specific barriers based on their structural and social and historical determinants of health. So these are some of the initiatives that are happening, but at the moment they're happening at the grassroots level and regionally. What we need to do is start to connect them to one another so we can learn from one another, demonstrate the momentum here, and continue building toward more systemic interventions. Next slide. Here are a few more examples based on the kinds of things to which people might be referred here in Canada. Museums, time outside in nature like I'm doing today, food on prescription, or getting active. And of course, you've heard about lots of more different kinds of examples. These are just a few that are already underway here in our country. Next slide. So what we're trying to do through this Canadian Institute for Social Prescribing, of which the Student Collective is an important member and contributor, is to systematize, scale, and spread social prescribing all across our country's diverse health systems in all the provinces and across our different communities. We really want to prioritize health equity, collaboration between different organizations and different people, and the leadership of communities in that work of co-producing what matters to you, what matters to us as communities, with a focus on our strengths, not just what's the matter with us, but what matters to us. How can we move that forward? What is strong over what's wrong? And these are the kinds of things that we want to make sure happen so that we don't see a co-optation of equity language or community language by mainstream systems that might continue to pull healthcare in directions that we know have fewer returns on investment, fewer opportunities to really innovate on what we know is a huge proportion of our health and well-being that's determined by our social, structural, and systemic determinants of health. And so at the moment, we have a number of community partners from right across the country who are participating in our collective impact project that's funded by the Public Health Agency of Canada and backbone support provided by the Canadian Red Cross. So we've got the United Way, the March of Dimes, EGAL, which represents people from LGBTQ and Two-Spirit Plus communities. We have the Black Health Alliance. We have Indigenous leadership from the Canadian Red Cross. And we have many other partners who have come to the table to have conversations about what this could look like across the country. Next slide. Here's a brief overview of what this looks like. We have a significant component of research and evaluation underway to help give us a leg up in understanding what we need to know in order to continue scaling and spreading, to understand who might this benefit, under what conditions, and how might we support it, and how might this help decision makers and funders in Canadian health systems and services to meet their goals and to help meet the needs of the communities that they are trying to serve. If you happen to have a particular interest in the policy side and the scaling up, that's where my own research comes into play. So reach out to me at kate.mulligan@utoronto.ca if that's something you want to continue exploring. So we've got all sorts of evaluation and research. We have participant advisors, which are people with lived and living experience, whether social prescribing participants, potential participants, or families and caregivers or community members who advise us directly. And we also have a number of communities of interest or work streams where people can focus on what matters to them and self-organize to meet one another, to find ways to connect, build projects, access funding, and continue the conversation here across the country. So again, we have streams on policy, on training and development, and on for clinicians, and a range of different things happening right across the Institute. I really encourage you to check us out at socialprescribing.ca to find out more. And I'll let you know that we have our official launch happening on October 6th. And so reach out to our student leaders here on the webinar today, or find out at socialprescribing.ca for more information about how to join that webinar and learn more from leaders in social prescribing from right across Canada, who will tell you the latest on what they're doing and how we're going to be advancing this work. And I'm very proud and pleased to be working with all three of the co-leads of the Canadian Social Prescribing Student Collective, who are doing fantastic work. We really need you. We need students and early career professionals to demonstrate that this is the future of health and well-being work here in our country and around the world. We need your leadership. We need your support. We need your energy. And we need your expertise. You have lived and living experience that is so valuable to the work we're doing. And your training will be bringing cutting edge techniques and approaches to the work. And so we want to be able to support you in that, to learn what your needs are, and to continue advancing this work together. So thanks so much. And I look forward to hearing from many of you over the next months and years.
Thank you so much. It's all such a great, just an honor to be hearing from the wonderful Kate and Bogdan, and to be working with you both is so wonderful. And I know I'm speaking on behalf of the collective and the students here that we are just so grateful to you. So as a group of students, obviously inspired by incredible leaders in the field like Bogdan and Kate, we started a student collective, which is ultimately just a group of students passionate about social prescribing. So I'm going to take you sort of on a timeline on the next slide, and we'll see just a brief overview of where we started and where we are today. And then my colleague is going to take us into a bit of a deeper dive. So we started by using the framework released by the Global Prescribing Alliance in late 2021. We watched their webinar, and after our meeting, the three of us decided to use their framework to create a student collective in Canada. We then started by creating our mission and our values, and these are integral components of the work that we do. We then launched officially on Social Prescribing Day on March 18 in 2022. We launched our Twitter page on the same day, and we've been growing ever since. And as of this morning, we have 363 followers, which is really exciting. We have multiple working groups and several school chapters that my colleague will go into a little bit later. We're also on the global scale because we joined the Global Social Prescribing Student Council, which is a global council there. We're also linked with several academic partners and institutions across Canada, and we're linked with community partners such as arts and culture groups as well. We're also working with partners to develop and implement prospective curriculum changes, which is very exciting, as well as implementing social prescribing on campuses across Canada, which is very new. We've also hosted several webinars, such as this one, at the Centre for Innovation in Campus Mental Health and the Australian Social Prescribing webinar. We also have been hosting our own general meetings for our members to catch up and provide updates on next steps. We also send out regular newsletters for those signed up for them. And I'm obviously a bit biased, but the newsletters are a really fun and informative read. And we also have a LinkedIn and a website on the Canadian Institute for Social Prescribing's page. So that's what we've sort of done up till now. It's been a lot of work and it hasn't been a lot of time, but we've grown significantly and it's been wonderful. If anyone's interested in our process, we're currently working on a process guide, so keep an eye out for that. And now Le-Tien's going to go into some more detail about who we are and what we've done so far.
Thanks so much, Nilu. As the Canadian Social Prescribing Student Collective, our mission here is to build the social prescribing movement across Canada. Our values are to collaborate with peers, communities, policymakers, and researchers across the country to educate our peers on what social prescribing is and why it's so important, to advocate for the inclusion of social prescribing in our schools, communities, and policies, and to discover new and innovative ways to practice and research social prescribing. Next slide, please. Since we've launched in March 2022, we have over 100 members across Canada that span over 6 provinces and 20 universities or colleges. Our members come from a variety of backgrounds with over 40 undergraduate students, 30 master's students, 10 PhD students, and 10 health professional students. Next slide, thank you. We work closely with the Canadian Institute for Social Prescribing, as Kate mentioned, and we're constantly looking for ways to further involve our students in both the national and international fields. At the international level, we represent Canada at the Global Social Prescribing Student Council, which brings together the leaders of social prescribing student groups around the world to advance the global social prescribing student movement. We connect with international students to share what we're doing in Canada, and we love to learn more about what other students are doing across the world. At the national level, we host general meetings with all of our members, like Nilu mentioned, as well as 5 working groups. We have our research, policy, practice, knowledge translation, and medicine working groups. These groups collaborate on the national level to work to advance our understanding and practice of social prescribing. And they work really closely with the communities of interest at CISP, as well as their own individual projects. Next slide, thank you. At the local level, we have 5 university chapters growing, and they've just launched this fall. They collaborate with schools and their surrounding communities to learn more about social prescribing and how to innovate the practice. And these groups, and we're really excited about these groups, are doing great things. For example, the Brock University chapter is working to implement social prescribing on campus, and that is the first time we're seeing that in Canada. So it's really exciting stuff that we're working on as well. As you can see, we're excited about where this can take us, and we're just getting started. So if there are any students listening today and are interested in joining us, we're pleased to welcome you. If you have any feedback, ideas, or comments, please feel free to reach out. For academic and community partners, we're eagerly searching for more partnerships as we continue to grow our movement. Reach out to us if you have any ideas on collaboration or how we can support one another. And as Nilu mentioned, we also have a great newsletter that shares what we're up to. Next slide, please. Thank you. After this webinar, we'll be sending out an email with additional contact information or ways to sign up. For now, you can see our email, website, Twitter, and LinkedIn here. And I'd like to thank everyone so much for their time today. It's been a pleasure to be here. We'd like to open the floor to any questions for our speakers or for ourselves, and please feel free to type them in the comment section, and we'll try to get as many questions as possible. Thank you so much.
Amazing. Thank you very much, Le-Tien. And let's see if we can get some enthusiastic questions from around. And also, it would be nice to get a call for action in terms of perhaps what have you taken away from this. So perhaps write one thing that you thought was exciting or interesting, and we'll try and spotlight it on the screen. It'd be really nice to get some of your feedback and some thoughts. We just get Kate in there as well. So you've got the whole team in here. It'd be fantastic to share some questions. Let's see if you can comment or write any of your questions down there, and we'll spotlight them in there. And then maybe I could go and start with one. So perhaps, Caitlin, one for you. What has made you get involved in this student movement? Why, out of all the topics you could have done a PhD on, why on earth social prescribing?
Yeah, that's a fantastic question. I really think it stems from my background in public health. So I did a Master of Public Health, and then I actually had a chance to work as a health promoter in public health after that for a little bit. And so when I began my PhD in health, I really wanted to try and find something that was health quality meets public health. And for me, when I came across social prescribing, I was like, this is it. This is what I'm looking for. I love this. This really is kind of that upstream approach in our healthcare system. And then when we came across that framework that was released at the end of 2021, and we realized, oh, wow, there is no student group in Canada. And, you know, here I am, this lonely PhD student, thinking I'm the only one researching social prescribing. I need to connect with other students. So it was just a fantastic opportunity. And it's been incredible to see the growth in under a year, really.
Amazing. Thank you, Caitlin. That's super inspirational. I think that's how we all started as well back in the UK as well. I think there's some energy behind from the younger generation as well, trying to say that things can no longer go like they used to as well, and that we need to cause a shift in values and beliefs, one that looks at the intersection between health and the other elements. And we speak a lot about the arts, we speak about nature, but more often than not, I think we should talk a lot more about practical support, such as financial support, practical well-being, and emotional needs as well. Now, we've got a question in here from Marianne, who's asking, how can we find out more about local social prescribing initiatives? For example, in Ontario or other provinces, are certain populations targeted? Kate, I feel this is one for you perhaps, and I can bring you in on that one.
Thanks, Marianne. Great question. We are in the process of developing a map of social prescribing initiatives that are happening all across Canada. So if you're listening and you are aware of one, send it in to CISP, and you can go to our website and fill out a form so that we can add it to our growing map. And we're collaborating with the Alliance for Healthier Communities on this. And the Alliance is the community health centers and other primary health care organizations here in the province of Ontario. And that's where we did our first prescription community pilot project. And so there is a lot of social prescribing happening in community health centers. There's a follow-up program called Links to Wellbeing that's geared to seniors, that links community health center clients with seniors active living centers. Sorry for the background noise. And there are also many others happening in the provinces where you are located and territories where you are located throughout the country. So you can try just Googling to see what's going on. You can type in social prescribing in your city or your province or your town, your health authority, and you'll be able to find out what's happening. But soon we'll be able to have that map. Now I've got it playing overhead, so I'm going to send it over to our student leaders.
Amazing. Let's see. Caitlin, would you like to pick that, or any of the other students in the room want to pick on the follow-up for that as well from Kate?
No, that's fabulous. Yeah, we're helping to contribute to kind of build that map right now, and we're happy that our students are actually kind of a part of many of those initiatives. So we're really thankful for that, and yeah, I think Kate covered that really well. Thank you.
Amazing. Thank you.
I'll just add, now that the plane has gone by, sorry about that, that many are targeted to specific populations, but not all. So again, as you find, the community health centers may have initiatives targeted toward young families or to older adults or as you saw in one of the examples that I shared earlier, toward Black populations or Indigenous populations. So it depends on the community, and it depends on the readiness, and it depends on what's available in your area. And that's one thing we love about social prescribing, is that it is highly context specific to the people and communities and the strengths and needs that are out there. So stay tuned. We should be able to share at least an initial version of our map by the time of our launch on October 6th.
Absolutely. Thank you, Kate. We'll be staying tuned, and then maybe we can provide a link at the end of this event so that people can sign up and join that as well. So I'll definitely put a link whilst you answer the next question as well. We've got some fantastic questions coming in. Please keep them coming in. Let's take them one by one. I've got one that I feel personally compelled to respond. Tarek is a fantastic question, saying that exciting to see physicians give an extra time to check on their patients in social situations. How do you intend to promote this among other physicians and collaborate with the healthcare professionals? It's a fascinating question, and I'm hoping to put a link down in here, but the Social Prescribing Champion program that we launched in England really looks at the idea of involving not just medical doctors, but involving non-clinical staff in the process as well. So it's championing the subject from within the profession. It's providing education and tools for example, discharge coordinators, physiotherapists, occupational therapists, pharmacists, to know that they can also refer to the social prescribers. And that also links a bit to another question, and Kate, I can refer to you as well for an answer to this, but Guy was asking and talking about the model shown as the healthcare as the source of referral, which is a fantastic question there. Whereas in a community rich with community supports, how do you engage them in this process? And that's completely right, Guy. And although we've kind of said that the clinician is the one making the referral, that's not entirely true. As you all know, in fact, many referrals now come from self-referrals. Many referrals come from people within the community. We've had firefighters, police members, hairdressers in the UK making the referrals, the discharge coordinator, the general practice manager. Any health professional can make the referral. It just so happens that within primary care, usually would be the GP making the referral. But you're spot on there, Guy. The support of the local community sector is where it thrives, and without whom it doesn't happen really. And Kate, I'll let you add on that as well, because I know you'll be enthusiastic to tell more about the community support.
Absolutely. Every door can be the right door for social prescribing. That's a really important message, and thanks for reinforcing it, Guy. I think we we have started in primary care, but as Caitlin mentioned, it's happening in different ways across the world. We have rehab hospitals in Singapore leading the way. We have acute care hospitals and hospitals for older adults leading the way in Ireland. And we have community-based referrals. Imagine if we were able to self-refer at a kiosk, just like we sit down to check our blood pressure when we go to the pharmacy. Imagine if we could sit down and fill out a few forms and get a referral right then and there, or get a referral while we're waiting in line for a COVID vaccine. There are many, many different opportunities to connect. And so in a lot of the communities where we're seeing social prescribing happening here in Canada, the leadership and momentum really is coming from those community agencies as much as from healthcare organizations, if not more. So it is very important that we do that work of outreach locally, regionally, and across the country to foreground their leadership and expertise when it comes to this. And that's one of the reasons why community organizations are so pivotal to the early work that we're doing at the Canadian Institute.
Amazing. And there's one question in here for the student. For the leaders, during your ongoing work with student champions and the past secondary institutions, do you find that connecting with the student unions has been helpful? Let's see, perhaps let's go to you, Le-Tien, first.
Great, thanks so much for that question. So what we've been doing in trying to reach out to students so far has been trying to get the students with a high interest in social prescribing first, just to get, because as we all started learning about social prescribing, we all thought we were the only ones. So what we have been doing was reaching out to our colleagues and peers to see if there's anybody who is starting or who's working on it or interested in social prescribing first. But since then, we've tried to go more on the education route and reaching out to students who may not know about social prescribing, who are very interested in the values of social prescribing, but haven't quite but don't have really the terminology, and that's how we're doing it. So right now we're reaching out to programs, but student unions are definitely on our list, and we're hoping that by doing that, we'll be able to pique interest of those who, again, might not know exactly what social prescribing is, but really believes in the core values that it has.
Amazing, thank you, Le-Tien. And there's a follow-up question to that from Leonid as well, who's saying that this sounds like all common sense and community-based medicine, and it is exactly that. We encourage students with ideas for projects to get involved. I think there's a practical question perhaps for you, Caitlin, in there in terms of how does it work if they're a student and they want to be involved. How does it work, and do they share ideas of projects, or how can they support your work?
Yes, we would love for you to get involved with us and connect with us. So as we shared our email, please reach out to us. Anybody who signed up for this event as well, we are going to be sending you an email shortly so that you can connect with us. We would love to connect with you, students in Canada, students outside of Canada, people who aren't students, people who are, academics and community partners who want to collaborate with us. Please reach out to us. We would love to collaborate and connect with you.
Absolutely, and there was another one in there, especially around if they're no longer a student, certainly get involved. And Kate was mentioning the Canadian Institute of Social Prescribing, and we can also support through the Global Social Prescribing Alliance and introduce the wider collective as well. And there is one more question in there as well, which was, I think this might be one for me. How did the student movement contribute to the practice of social prescription in the UK? In very simple words, we felt like this term was used back in the day, and we loved the term. It was called the revolution of the peasants. And it was called that because the lowest of the ranks, the students, started doing work on a topic that just felt as if it was falling beyond the remit. But we loved being called the revolution of the peasants at the time. And like you all, starting with the students in Canada, we did too on the grassroots with students in medical schools, and then more widely allied healthcare professionals. And now pleased to say that every single medical school in the UK has social prescribing at its core as a module. I teach the module on social prescribing at Imperial College in London, but each medical school has their own social prescribing module now, which is very exciting to see. And I know there was somebody from Singapore earlier. Congratulations from Duke University, because I know our colleagues in Singapore have implemented social prescribing successfully in medical school there too. So we look forward with news from Canada as well for that to happen soon. And it sounds like you're not far away from that target at all. Kate, one question from you from Karina. It says, a question for Dr. Mulligan. Have there been any interest within the Northern Ontario health centres, perhaps from your pilot project with the Alliance for Healthier Communities?
Yes, absolutely. Karina, check out Prescription Community through the Alliance, and you'll see several rural, remote, and urban northern centers represented. I saw there was a question also about French speakers. The Centre de Santé Communautaire de Témiscamingue has a wonderful social prescribing service for Francophones and a beautiful video online. So you can Google them, Témiscamingue, CSC, and find out more about what they're doing. There's also great French language stuff happening in the province of Quebec. The Red Cross has Proximité des Aînés, and you can also Google that one to find out more.
Amazing, wonderful. Thank you, Kate. Now, 2 minutes. Nilu, tell us your final takeaways. If there was one message you just wanted to tell people for getting involved, what would that be?
I just say stay excited, because this is just starting in Canada, and it's just so wonderful to have leaders like Kate on the call today, and she's leading it across Canada, and to be a part of the student collective is just such an honor and so wonderful, and everyone on our team has so much energy and momentum. I just feel like we're just getting started, and it's already so exciting. So I would just say keep this in mind, is to be excited and just keep this movement going, because it's just such a wonderful movement in Canada, and I'm very happy to be here with you all.
Wonderful. Thank you, Nilu, for that. Caitlin, take away, very quick message for everybody as they go.
Join us, get connected, let's collaborate.
Amazing. Widen the family. Le-Tien, over to you for takeaway messages.
Thank you, everybody, for joining us. We're super excited to get to connect with everybody shortly after this. And yeah, like my colleagues have said, please stay excited. Please join us, and we're ready to innovate and work with anybody who's here.
Amazing. Kate, over to you for some final words.
Students, young professionals, each one of you has something to offer that no one else in this world can do. We need you. So looking forward to seeing you soon and often.
Wonderful. What an inspirational webinar. Thank you ever so much for those of you joining and tuning in. That was highly inspirational. As Kate was saying, each one, teach one. Let's grow this family. And it does sound like for once we're playing the long-term game. No more short-termism. It sounds like providing future hope for the future generation. And I'm looking at Le-Tien, Nilu, Caitlin, and the support that Kate is providing, and all the students involved in the webinar. I think the future does look very bright. I think, Kate, as bright as your orange t-shirt, I think as bright as that, I'd say. Amazing. Super. Thank you so much, everybody, for joining. Have a wonderful evening. And thank you. And you can watch this online. We'll post the links for the call for actions as well. Thank you so much, everyone. Bye-bye.